Today, a story of rabbits and a white powder. That white powder you probably don't recognize, but it's in your arteries. This is cholesterol, and therein lies an interesting story. That story starts way back in 1908 with Alexander Ignatovski, a Russian physician. He was a student of Elie Metchnikoff, a Nobel Prize winner. You may remember his name because he thought that yogurt was the key to longevity. But he also thought that excessive intake of protein is what made people age. And this gentleman decided to study that further. So he took some meat and butter and milk fat, and because those had high protein content, and fed it to rabbits. And indeed, the rabbits didn't do well. When they were autopsied, they were found to have lesions in their coronary arteries. Those lesions were found to contain cholesterol. And that's when the baton was passed over to Nikolai Anichkov, another Russian physician, who then figured that maybe it wasn't the high-protein diet that was the problem. Maybe it was specifically cholesterol. So he fed cholesterol to rabbits, and they developed lesions in their arteries. These lesions today we know as atherosclerosis. Well, the scientific community didn't think much of that. Feeding rabbits cholesterol, rabbits are vegetarians, what do they have to do with humans? But Dr. Lester Morrison, who happened to have been a McGill graduate, although he went to the US and practiced in Los Angeles as a cardiologist, took the rabbit study seriously. And he saw a lot of heart attack patients in his private cardiology practice. And he decided to carry out a study. He took every second patient that had had a heart attack and put them on a low cholesterol, low fat diet to see what would happen. Now, this was not a randomized double-blind study, kind that we would like to see today, but nevertheless, it was pretty significant. He had about 80 patients, and it turned out that the patients who were on the low-fat, low cholesterol diet showed better exercise tolerance, they had less angina, and actually during a follow-up of 5 years, they lived longer. But, the message didn't get spread around because he was sort of a lowly cardiologist practicing in isolation in Los Angeles. But believe it or not, the world heard about all of this cholesterol and fat issue from someone who wasn't even a physician or a scientist. That was Nathan Pritchett. Pritchett, at a young age of 41, was diagnosed of heart disease. And he thought that this was unbelievable because he had led what he thought was a healthy lifestyle. But he started to do his own research, as people do these days, and he came upon Lester Morrison's work. So he decided that he would give this a try. And he went on a low-fat, low-cholesterol diet, started to exercise, and indeed, when he had cardiac tests, he turned out to be totally healthy. He wrote a book. It became a bestseller. And that's when people started to pay attention to incorporating low-fat, low-cholesterol diets to reduce the risk of heart disease. By this time, it had been shown quite conclusively that it was the blood level of cholesterol that could determine the risk of heart disease. And the diet lowered blood levels of cholesterol, but this was really brought to fruition by Dr. Dean Ornish, who was a properly trained scientist and physician, and he organized a real random double-blind controlled trial where some patients were put on a diet that was very, very low fat, a vegan diet essentially, exercise regimen. They were taught to practice yoga and meditation, and they were compared to others who also had the same kind of risk factors, but were just told to carry on with their life with the sort of the normal low-fat, low-cholesterol exercise, but not the extreme regimen that Ornish organized. And it turned out that the Ornish diet people did a lot better. They lived longer because their heart disease actually was reversed. Now, it wasn't a huge study, and there's still some controversy about it, but we've come a long way since the cholesterol feeding of the rabbits in 1908 that started the whole cholesterol story. The moral? Keep to a low-fat, low-cholesterol diet, and don't feed cholesterol to your rabbits.